On this episode of Mental Health Matters, we will be discussing substance use, abuse, and mental illness. We will talk about what is a substance use disorder and classify what is mental health and mental illness. Furthermore, we will look at risk factors that contribute to substance use and mental illness, and then look at what resources are available for people who have these symptoms. Substance use disorders are characterized by impairment caused by the recurrent use of alcohol or other drugs, including heroin, cocaine, meth, etc., or both drugs and alcohol. Substance use disorder changes our normal desires, our priorities, our behaviors, and interferes with the ability to have good relationships with friends and family. This impairment could be categorized as including health problems, a disability, and failure to meet major responsibilities at work, school, or home. Any substance, be it prescribed or not, has an impact on the body's central nervous system. When people take substances, it will affect their physical and mental state. Mental illnesses are conditions that affect a person's thinking, feeling, mood, or behavior, such as depression, anxiety, bipolar disorder, or schizophrenia. Such conditions may be occasional or long lasting and affect someone's ability to relate to others and function each day. This is not to be confused with mental health, which is described as our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Although the terms are often used interchangeably, poor mental health and mental illness are not the same things. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of physical, mental, and social well being. Common risk factors that can trigger mental illness and substance use disorders are excessive stress, trauma, physical or sexual abuse, living in a war zone, or other types of unsafe environments, neglect, poverty, or other negative experiences the brain has difficulty processing. These experiences can be experienced at even higher rates for BIPOC or Black, Indigenous, People of Color individuals in our society. According to SAMHSA's National Survey on Drug Use and Health, Native Americans have the highest incidence of co occurring disorders compared to other groups at about 3.8%, followed by 3.4% for the Hispanic or Latin community, 3.2% for the Black community, and 2.1% for the Asian community. There is a serious stigma that implies a mental health problem is a sign of weakness and should be kept hidden from others. Additionally, issues like systemic racism and the lack of culturally sensitive treatment by providers may also play a role in the way BIPOC communities views mental illness and treatment. It is not normalized in the way that it should be. People often view it as a personal and or moral defect. As a result, the mental health field is viewed along the same lines as the other systems that have caused substantial harm to BIPOC people. Experts suggest that a person with co occurring disorders has a higher risk of severe mental health problems, suicide, being violent, victimization, both in terms of domestic and stranger violence and abuse, homelessness and unstable housing, contact with the criminal justice system, family problems, a history of childhood abuse, whether sexual or physical, slipping through the net of care, difficulties with or lack of compliance with medications and other treatments, or poor physical health. People experiencing mental distress and substance use need timely and expert support, particularly in times of crisis. Too often, they are bounced back and forth between different services at a time when they need help most. People with co occurring substance use and mental illness often face double discrimination and stigma. Systemic reviews suggest that those who receive integrated mental health and substance use services do show clinical improvement, and report treatment satisfaction. Despite the stigma that persists in BIPOC communities, seeking help to enhance your mental wellness is not a sign of weakness. Instead, it is a sign of strength, confidence, and resilience. If you or someone you know is experiencing any symptoms of substance use and or mental illness, please reach out for help from your local community health center, mental health clinicians of Color Grand Rapids, or you can call the Substance Abuse and Mental Health Administration, or SAMHSA, National Helpline at 1-800-662-HELP or 1-800-662-4357.